Now, if you look at February 2024, I think it was, is when they ONS actually changed the way they calculated excess deaths. And what they did is they essentially raised, so I think excess deaths is calculated the difference between the baseline of what's the expected deaths and to what we're actually seeing. And it's that difference is the excess. They raised the baseline. And when you do that, excess deaths gets reduced,
Uh-huh.
as a follow on from that. And so that's what they did. So again, that's a way of fudging the numbers, right? There was a study done from the Netherlands. I think it was called Monsert et al. Study that was published in the BMJ Public Health. Do you remember that study? That was published in June 2024. I wrote about this study. And what they calculated, these researchers, I think from University of Amsterdam, um, that there were 3 million excess deaths I think, from January 2020 right to the end of 2022 across 47 countries. There were 3 million excess deaths, but what their study revealed was the reported number of excess deaths was highest in 2021, okay, when we've got the rollout of the COVID shots. You had the Telegraph reporting on the back of that, and I think they ran the headline, COVID vaccines may have helped fuel rise in excess deaths. As soon as that article ran, you have the oncology center. This is Princess Maximus Center, which is the center that the authors were affiliated with, suddenly distancing itself from this paper, saying this is completely, it's not meant to be. It's been misunderstood. We're distancing itself. They just basically sort of step back, and then after that, you have what was triggered. The BMJ Public Health issued a statement saying they put expression of concern over that study. So this is another way of suppressing, sort of throwing mud at these studies that are bringing up any harms or sort of just raising the alarm bells here. They are getting like, oh, this is they're getting trashed. These studies are, no, this is not good. It wasn't meant to be like this. They're questioning the integrity of the study. So, and you've got a lot of others that have been, withdrawn, retracted. You've got definitely censorship going on within the scientific journals as well.